Hi, I'm Dr. Angon Lissar. Today I'll be discussing how to approach a patient with complaint of falls in NAC OSCE. Please note this video is for educational purposes only. Firstly, a bit about falls. It's a common complaint, especially in the elderly population. It has various causes, so whenever a patient comes, we have to think broadly and then ask specific questions to rule out each one of those causes. While managing the patient, we should focus on the cause of falls, educate the patient regarding it, treat the cause, and also follow up to prevent any additional falls in the future. Going to the causes of falls, these are some of the common ones I have listed in the table. First, for falls syncope. It can be vasovagal. It's usually when a person faints after prolonged standing or after listening any stressful news. It can be due to cardiac defects like valvular diseases, conduction defects, orthostatic hypotension, which results from a postural decrease in blood pressure. Neurological causes can also be one of them, like cerebrovascular accident, seizures leading to loss of consciousness, and falls. It's very important to inquire about the environment, like how was the lighting at that time, were there any obstacles in the way, like loose rugs, furniture. Then there are some sensory disturbances which can also lead to falls. Vision impairment, hearing impairment, peripheral neuropathies which can lead to numbness and tingling, and it can be a contributor of falls. Vitamin B12 deficiency is one of the causes of peripheral neuropathies. And after this we go to the balance. So if there is any balance abnormalities due to cerebellar degeneration or normal pressure hydrocephalus, it can be one of the causes. If the patient is taking multiple drugs like anticholinergics, diuretics, they can also contribute to falls. Poor footwear, excessive alcohol intake, and lastly, it's good to rule out abuse in every case. Whenever we start taking history from the patient, we introduced ourselves. We asked the patient, how would you like to be addressed? Then we asked the main complaint and any other concerns apart from that. Then we start from the main complaint. So it's very important to establish the event in this case. And it's good to ask that whether it is the first episode or any history of recurrent falls in the past, any injuries you encountered while during the fall. And when we are inquiring about the fall, so it's good to ask the questions in three parts, like preceding symptoms and what happened during the fall and post-fall symptoms. For example, in preceding symptoms, we can ask about nausea, diaphoresis, it can be a sign of presyncope, chest pain, it can be a sign of cardiac causes. Then during the fall, we can ask about any loss of consciousness, any injuries, any help he got from anyone around him. Post-fall symptoms can be like any confusion, any weakness in any part of the body. Then, as we discussed in the last slide, environment is very important to inquire about. Best vision, hearing ability, any help at home, balance problems, weakness, numbness, nutrition. This numbness, nutrition, they are very important to rule out vitamin B12 deficiency. And then we ask about the best memory of the patient to if we are suspecting any neurological causes. Then other portions of the history, past medical history, to rule out chronic diseases, medications, any recent change in dose of medications, excessive alcohol intake, and abuse. Whenever we are taking history, it's very important to rule out the red flags. In this case, the red flags can be loss of consciousness, chest pain. Chest pain can indicate cardiac causes, unilateral weakness, dysarthria. It can be a sign of cerebrovascular accident, incontinence, tongue biting. It can be a sign of seizure. So if any of the red flags are present, then we have to investigate the patient appropriately and give appropriate treatment. When we are done with the history, we come to the physical examination. In every patient, we start with the general physical examination. In this case, vitals, mucous membrane, skin turgor. are very important to assess any signs of dehydration. Then cardiac exam, we assess the JVP, assess the pulse, listen for any murmurs, carotid bruits to look for any valvular diseases. Then in the neurological exam, we assess the visual acuity, hearing, motor power, sensory exam, cerebellar signs, and Romberg's test to look for any balance abnormalities. We ask the patient to take a few steps to assess the gait and the footwear. And lastly, we can assess the cognition by performing a mini mental status examination. When we are done with the history and the physical examination, usually we have some differentials in our mind, and we can order the investigations according to them. This is a list of common investigations in a patient with falls. Complete blood picture, electrolytes to rule out any electrolyte deficiency, BU and creatinine, thyroid test, B12, serum glucose if you are suspecting hypoglycemia. If you are suspecting neurological cause, we can order CT head. Then in special test, ECG. If we are suspecting cardiac cause, toxicology screen if suspicion of substance abuse, EEG for seizure, NCS EMG if weakness in any part of the body. When we are done with the workup, usually we have one specific cause in our mind, and then we treat accordingly. This is a general advice for a patient with falls, like ask them to improve lighting, floor should not be slippery, footwear should be appropriate, and if they have some balance problems, we can advise Tai Chi exercises. They help in improving balance. Remove the obstacles from the way. If required, use bench seats for bathing. And if they have some vision abnormalities, so it's very important to advise them to have the annual checkup for their eyes. Then the specific treatment depends on the cause. So we treat the cause and we educate the patient about the cause. After that, we ask the patient that do they have any questions in their mind, any concerns. We address those concerns and we satisfy them. Then we follow up the patient regularly to see that whether they are responding to the treatment or not. So this was all about the patient of falls from my side for NAC OSCE. I hope you got some useful information for your exam. Thank you so much, and I wish you all the best for your exam.